I'm here today to talk to you specifically about dotFIT's efforts as it relates to elite athletes throughout the world of college and pro sports. First and foremost, it's important for you to know that dotFIT is a research and development company that delivers holistic, evidence-based programming, products, and support to over 1,200 sport, fitness, and health facilities and over 40,000 sport and fitness professionals. And our sport and fitness professionals, in turn, support millions of consumers around the world. When it comes to dietary supplements, guaranteeing safe and effective products requires processes that other companies don't perform because they don't have to. dotFIT, on the other hand, is a practitioner product, meaning before we can produce or recommend a product, we must validate the formulation by matching the ingredients, their forms and amounts, and dosing instructions with those shown to be effective in clinical trials. When that entire process is complete, we must then third-party test the completed formula. There are many companies who claim they third-party test their products, and a few of those actually do. Those who do receive authorized labeling, but in the world of elite athletes, here's the catch. Just because you third-party test a supplement to prove it's clean from drugs and heavy metals and the ingredients listed on the label are in the bottle at those amounts, doesn't mean it works. And third-party testers, such as NSF, clearly explain they do not test for effectiveness. The test only means the product is clean and the label amounts are accurately listed. So, how do you know those amounts or the formulas work? Products found in the mass market are notoriously underformulated because they have to compete on price. And they're aware that the buyer generally has little knowledge of what an ingredient's effective dose should be based on clinical evidence that's published in peer-reviewed journals. So while the buyer may know the name of the ingredients they're looking for, they most often will not know the effective dosing amounts, protocol, or proper ingredient forms that were used in the actual clinical trials required to demonstrate overall product effectiveness. Therefore, you need two pieces. One, clinical documentation of the effective ingredient amounts, forms, and dosing protocol. And two, third-party testing for formula accuracy and cleanliness. Only after you have two steps do you have a product you can guarantee will work as claimed and is safe. So in summary, you need to prove the formula works as claimed through third-party peer-review ingredient studies and make that documentation available to everyone like we do through the Practitioner Dietary Supplement Reference Guide. And then two, you need to third-party test the final product to make sure it matches the documentation. Anyone can third-party test any final product, but that doesn't mean it works. If I'm regularly advising my family and other elite and professional athletes from around the globe to put something in their bodies, and we know they're going to be regularly monitored and tested, I better be damn sure it works as advertised.